Okay, we are live and recording. Welcome back to Finance 1. We are going to, oh, hang on one second. All right, we're going to wrap up our work with Chapter 1 today and move on to Chapter 2. Chapter 1 homework is due on Thursday. Thursday. So we went through, last time we went through the problems of the advantages and disadvantages of different forms of business. Yes, ma'am. Okay. What? Yeah, okay. Yeah. Is it for 621? Okay, why don't we talk about that after class then? No problem. Okay, so last time we talked about the different primary forms of business and their advantages and disadvantages. You need to know that for the exam. You look at the old exams, I always ask a question about that, right? So you need to know the difference between a sole proprietorship, a partnership, and a corporation. Those are the three most basic forms of business. And you need to know the kind of the pros and cons of each of those types of doing business in each of those business forms. There are a whole bunch of other animals out there in our business environment, and those include and we're not going to talk about these in any detail, but you'll hear these phrases: a limited liability, and I'm not going to test you on this, a limited liability corporation, a limited liability partnership, S corps, right? Professional corporations, PC. So you'll see some of these other names of things out there. You will learn about them as you go along. Most of them apply to smaller businesses. So these might be, an LLC is a good form if you're a relatively small number of owners. The business itself can be huge, but the number of owners, you see a fewer number of owners. So I just want you to know, the three we've talked about, sole proprietorship, partnership, corporation, are kind of like the most common, most generic examples. There are a whole slew of other kinds of corporate forms out there. So I don't want you to go away thinking, oh, there's just three. Right? There's actually a whole range of them out there. Most of them apply to smaller organizations than most of them apply to smaller organizations. I don't want to get too much more detail there. So just keep that in mind. Now today what I want to talk about is a little bit about ownership specifically. So, and the difference between a for-profit entity and a non-profit or not-for-profit, right? I said last time, you're going to see not-for-profit. You're going to see profit, right? You're going to see people use either non-profit or not-for-profit interchangeably. They mean the same thing. There's not a different kind of organization. So most entities out in the world are for-profit entities, right? And that means they are investor-owned. So I think last time we were joking around about, was it Cole owning a business, I think. So if you were to go out and start your own pizza place or or dog walking business, that would be an investor-owned business, right? You as the sole proprietor are the owner of it. You are an investor in yourself, right? Or in your own business. But also when you think about corporations, right? Corporations like Coca-Cola, Johnson & Johnson, HCA, right, are all investor-owned. And so some things about investor-owned, right? Investor-owned in particular, well, so let me pause for a second. So sole proprietorships, right, are all by their nature for-profit businesses. So you think about You go to a hospital like Wentworth Douglas, right? That's a not-for-profit corporation. Wentworth Douglas is a not-for-profit or non-profit corporation. It is a 501c3 not-for-profit corporation, so a charitable organization. However, the physicians who come in and take care of you, high probability that they are self-employed or part of a practice, right? That is a for-profit entity. So they have their own forms, but think of them as like a partnership. Oftentimes they're run something like a partnership. Depending on the state, they may have a different kind of corporation, incorporation form. Maybe one of these up above, particularly a professional corporation, that provides them some liability shield. But the physicians that come take care of you classically, the physicians that come take care of you in the not-for-profit hospital are sole proprietorship type organizations or partnership type organizations. They are for-profit, right? So you'll see kind of the smaller entities typically you think of are also for-profit, even though they're interacting with your not-for-profit system. Right. So that is not unique. That is 90% of the probably 99% of the healthcare industry operates like that. So the question was, say I went to Wentworth Douglas, I got a bill from the hospital, and then I got a bill from my provider. Right. So those are actually, so a hospital, and we'll talk more about this later, but think about a hospital is like a doctor's workshop. It's kind of like, the hospital provides the environment and the tools for the doctor to come in and do his or her business. And the hospital then bills, if you're a patient coming in, you get admitted to the hospital. The hospital will bill you for the room, for a variety of other services that they render to you, probably some testing and things like that. That will all come from the institution. And then you will also get a separate bill from, say, the surgeon. Like if you went in to get something simple like your gallbladder removed, like me, and something like that, right? Or you get appendicitis, and you go in, you'll get a bill from, you'll actually probably get, in that case, you'll probably get 3 bills. You'll probably get a bill from, Wentworth Douglas or whatever hospital you had your surgery in. You'll get a bill from the surgeon separately because they are separate entities. It is the surgeon doing business in the hospital. And then you'll probably also get a bill from the anesthesiologist, who is also a separate entity doing business in the hospital. Does that match up with what you saw? Right. Right. So, and then there could be other ancillary services that are rendered by, yet another party. This gets very confusing to patients, right? Because they're like, wait a minute, I already paid my, bill for, I paid Wentworth Douglas. Why am I getting this second and this third bill? Right. Exactly. So it's a common experience, and it is pretty, actually, as you guys get used to our world, it is, the more common format, right? Is because a hospital is, you think about a hospital like WeWork. You guys all heard of WeWork, the shared working space? It's like, no, haven't heard of it? Okay, so so like these shared working spaces where you like rent a desk in a kind of a cool, a cool place to hang out, and this is more common in big cities like Boston. You probably see these. So there's a company called WeWork, and they provide shared working spaces for people that don't, it might not be worth their while to rent an office because they don't need the office all the time, or they just want to, or they don't need a whole office to themselves. They just need a desk someplace to come. And so like WeWork is a cool company that provides these kind of hip places for people to come and bring your laptop, and they provide you a desk and maybe a little cafe or something in the building. And so in a sense, like WeWork is just providing the space for you to do business in, and then you come in and do it. A hospital, really, you think about a hospital, Well, so yeah, so a hospital is really, I think the best way to think about a hospital is it is like a doctor's workshop where the hospital is providing a service to the doctors. And as you talk to and you get more familiar with healthcare, I had this kind of, for me, you know, coming up through the military, the military is a lot like, say, Kaiser Permanente, an integrated system where the physicians are all employed by the physicians in the hospitals are all one organization. They're all, you know, for us, they're all the military. And so there isn't a separate bill. And, you know, some organizations like Kaiser Permanente have a similar arrangement where they're, you know, everybody is all one entity. And so the physicians are basically employed by the same organization that owns the hospital. And so so it's pretty much, if you go to a Kaiser hospital, you're only going to get cared for by a Kaiser physician. And I'm sure there are some exceptions, but that's kind of the general rule. If you go to a place like Wentworth Douglas, you're going to have a mix of, Wentworth Douglas does have its own physician organization. And so it's likely you'll get cared for by, I believe they're called Wentworth Partners, Wentworth Health Partners, or I forget the name. Exeter Hospital has Exeter Hospital and core physicians. And so if you're in Exeter Hospital, for example, you're likely getting cared for by a core physician who is an employee of the core physician organization, and both core and the hospital are owned by Exeter Health Resources. What was my point? I'm getting off track. No, you still get multiple bills. You'll get a bill from Exeter and a bill from core. It was, as you go up in the hierarchy in a hospital, if you wind up working in a hospital as opposed to a practice, one of the things that I learned kind of from, that caught me by surprise as I made my transition from health, you know, from the military health system to the civilian health system, where I was learning about the civilian health system, was physician management by the hospital. I remember listening to a former military guy who had retired a few years before me, came back and talked to us about his experience, you know, his own experience transitioning to civilian healthcare. And he was working in a hospital system. And he said, you know, the thing that we forget, or the thing we think about in the military health system, because we're all one system, is we think that the patient is our customer at a hospital. He said, in the civilian world, the patient is not really your customer. The physicians are actually your customer in the civilian world. Because remember, if you think about, and this is why it's useful to think about the hospital as a doctor's workshop. The hospital doesn't make any money unless a physician brings a patient into the hospital. The hospital can't just reach out and say, you know, hey, I'd like you to come, you know, get your appendix out, or come get an MRI. The hospital has all this equipment and has all these nurses and has all this space, but nothing happens unless a physician says, I have a hey patient, I need to do this procedure and I want you to go to Wentworth Douglas, or I want you to go to Portsmouth Regional. And so the hospital has to thinks of, the typical hospital thinks of the physicians as they're not employees, right? They don't think of them as employees. They think of them as customers, because they have to create an environment, a workshop, if you will, that is more appealing to the physician than the next competitor hospital is. And so you'll see physicians will typically have a relationship with a hospital. Sometimes they'll split their time between multiple hospitals. So here in this area, we have, you know, we've got about, we have 4 hospitals kind of in our general, maybe 5 if you count York. We've got Frisbee in Rochester, Wentworth Douglas in Dover, Exeter down in Exeter, of course, and then Portsmouth and Portsmouth, right? So we've got 4 fairly significant hospitals, and they're all kind of competing to attract physicians, because if they can attract more physicians, the physicians bring patients with them, right? So for a hospital to be profitable, it has to be an attractive space for physicians to come and bring and want to do their work. Otherwise, the hospital, because the hospital itself can't sell itself, right? It doesn't, nothing happens in a hospital without a doctor's orders. Yes. So can a hospital have a contract with with a physician? Yes, right. Yeah. So the question is, do the doctors sometimes sign non-compete with a hospital? Is it more the doctor's choice to work at a particular hospital as opposed to the hospitals? So I mean, I think it depends on the environment. You know, are there multiple competitors? It depends on whether a single hospital would have enough volume. You know, the population that the hospital services, would it have enough volume for the doctor to be fully occupied just taking care of the patients that would be attracted to this one hospital? So that's actually an issue, right? So I know an ENT doc, and she's done a little, you know, that she's seen me and she's seen some of my family members. She works at, I think she does patients at both, she used to do patients at Portsmouth and Exeter. And I think part of that is she's part of a small practice. There's, I think, 4 of them in the practice. And there just isn't enough volume at, say, Exeter alone or Portsmouth alone to keep 4 ENT physicians, ENT surgeons fully occupied. And so the hospitals aren't going to say, you can only practice at our facility, because they know that the physicians will leave, right? Because they want to be able to be fully occupied. So it kind of depends. So the answer is, it kind of depends. If you are a core physician, for example, if you're employed by core, you would have to, part of your contract would be, you're not allowed to do, you know, probably part of your contract would be, you're not allowed to see patients at Portsmouth, because they're not, right, they're not part of the same system, and they'd be competing. But it depends, right? So it really kind of depends on your relationship with the hospital. Right. So it depends on the specialty, depends on, can the hospital provide you all that volume? And that's a complex thing that we will talk more about. We'll probably talk more about in management as well. So let's, we're kind of a little bit off topic, but it's all important stuff. So we can think generally about sole proprietorships and partnerships as kind of default investor owned, right? And then we talk about investor owned corporations. It's a little bit different. So a corporation, so whereas we talked last time, a sole proprietorship and a partnership, there is no difference between the owners and the business, right? The owners are the business. Right, and this is where the liability element comes in, because there's no divide between ownership and management. The owner is the manager. In a corporation, it's possible to create a separation, right, between the owners and the managers, and that actually is part of the beauty, if you will, of corporations. Is you can be a part owner in a corporation and not be involved in the day-to-day management of the organization. So, for example, I own shares. I'm a shareholder in Genesis Healthcare, the company that owns, you know, I don't know how many hundreds of nursing homes, right? I'm a part owner of that corporation, and I have absolutely nothing to do with its management, right? So in my case, right, there's a complete divide, right, between ownership and management. With a sole proprietorship, if I was the sole proprietor of a nursing home, I would have to be involved with the management. I could hire managers, but ultimately, the reason that I am liable for the organization is because, as a sole proprietor, I am the business, right? With say a corporation, as a shareholder, my relationship is at a distance, in a sense, from Genesis. If I showed up at one of the, nursing at the Genesis nursing home in Hampton, or in Exeter, and I started trying to tell the staff what to do, they'd be like, "Who are you?" and get out, right? And I'd be like, "Well, I'm a shareholder," and they said, "Fine, get out anyway. Call the shareholder relations if you have a problem, but get out, right? You're not part of the management team." So there's a difference between management, or a separation between management and the owners and ownership, right? And the owners of corporations are called shareholders or stockholders. Because they own, what they own are shares of stock in the company. So typically what will happen is when a company goes public, right? So what that means is they are offering shares in their company. It doesn't have to be a public corporation, but I'm going to use the public corporation as kind of the example. The shares, the company forms as a corporation, right? So as a C corporation, forms as a corporation, and then it puts up, if it's public, it puts up its shares in a stock exchange, right? So like you might have heard of the New York Stock Exchange, for example, is the biggest one in the United States. The New York Stock Exchange will bring, if you want to have national, open up your firm so that it can be owned by anybody in the United States, you would put your shares on the New York Stock Exchange, or the NASDAQ is another one. That's for typically smaller companies, is the NASDAQ. And anybody could potentially buy shares. So for example, if you are interested in buying, in being a part owner in Genesis Healthcare, like I am, or you're interested in being a shareholder in HCA and owning a little bit of Portsmouth Regional Hospital, you could buy shares of HCA. Right? So when a company goes public, right, when it sells itself, it essentially sells itself to the public. Okay, and shareholders then it issues some number of shares. So let's say I'm HCA and I'm just now going public. I'm going to sell myself to the public. I'm going to become a publicly traded company. I'm going to issue 10 million shares. So people who are interested, who think HCA is a really good business, I think I could make some money by owning it, will buy some of those shares. Okay? And I'm not going through the initial offering. We'll talk more about that later. But basically, so there's 10 million shares out there. Right? And so for every share that you buy, if you want to be a shareholder, a part owner in HCA, for every share you buy, you basically get one vote on how the organization is managed. So if you want to have a big influence on HCA, you have to buy a lot of, there's 10 million shares. Each share represents one vote, right? You have to own a lot of shares. If you own 100 shares out of that whole 10 million, you're not going to have very many votes relative to how many votes are out there, right? But if you own 5 million shares, or 5,000,001 shares, you now have more than 50% of ownership of the company, and you can actually make decisions about how the company is going to be run. So if you own more than 50% of the company, you basically own what's called a controlling interest in the company, and you can tell the company, you can tell the management, this is what I want you to do on a day-to-day basis, right? So if I owned 51% of Genesis shares and I walked into one of those nursing homes, right, and I said, I want you to do this and this, they'd be like, oh, yes, Dr. Boniger, we'll do what, yes, whatever you want, right? They'd probably be like, who are you? And then they'd have to call somebody and call up to corporate headquarters, and then they'd be like, oh, what's he doing there? I guess you have to do what he wants because he owns the business, right? So I'm just being a little bit silly, but But basically, you can buy shares in companies, right, through the stock market. And for every share you own, you typically have one vote as to how the organization is operated. Now, so this refers to what's called the right of control. Which means that the shareholders and owners have the right to vote on the direction of the firm. Now, all corporations have a board of directors. And in a minute, we'll talk about not-for-profit corporations, and they have a board of trustees. Basically, the only difference is the name. So a board of directors, these are the people. So if you have a big company like HCA with, and I'm making up the number, 10 million shares, it's probably more than that, but I haven't actually looked. If you've got 10 million shares and you've got, say, 1 million shareholders, right, all who have a vote of some, some varying degree. Some people have 100 shares, some people have 1,000 shares, some people have 10,000 shares, right? Some of them aren't people at all, but mutual funds, right? So there's pension funds and things like that. If the CEO has to turn to all the shareholders every time they need to make a major decision, that'd be quite a ungainly thing, right? There might be 1 million shareholders spread out with different numbers of shares. Do you really want to have a meeting with somebody who's got 1 share? It's possible to own 1 share. And then you are a shareholder, right? You have a vote, but you only have 1 vote out of 10 million. So how much time do I want to spend listening to the person with 1 share when there's 9,999,000 other shares that, have just as much influence as that one person? So what corporations do is they establish a board of directors. The board of directors is elected by the shareholders. Okay? So the board is elected by the shareholders. And then the board, the most important thing that the board does is it hires and supervises the management. Or oversees, I should say. Oversees is a better way to say it. And it's really the CEO, right? The CEO, the board basically hires the CEO and fires the CEO when they don't think that the CEO is doing what they think the CEO ought to be doing. So the board hires and fires and kind of oversees the CEO. I say supervise, but when you're talking about somebody at that level, supervision is kind of it's not the same thing as, when we're working at a retail job, right? But it is, but they are. They're monitoring the performance of the CEO. The CEO is ultimately responsible for hiring everybody else, right? Appointing the CFO, the CNO, the CMO, and on and on and on. And then everybody below them. So the board is not involved in, Nurse Susie, right, down on, the Ward 3, over here, right? The board doesn't even know who Nurse Susie is, or Technician Bob, right? That's the CEO's purview, is to hire everybody else in the organization and provide that oversight of the organization. So the board is focused at the strategic level of the organization, deciding the overall direction of the organization. And they hire the CEO and they direct the CEO. This is the direction we want to go, right? CEO, we want you to go in this direction. Now the CEO doesn't just sit there and wait for the board to tell him or her. They typically have it. I mean, this depends on the size of the organization, right? I'm thinking of a fairly decent sized organization like a Wentworth Douglas or bigger, right? So that they're going to have senior management is going to come to the board and say, this is the analysis we've done, this is the direction we think we should go, and then the board is going to kind of bless it or say, no, we don't think we should go in that direction, we should go in a different direction. So if you think about a healthcare organization like a Wentworth Douglas, and I know I'm blending together here not-for-profit and for-profit, but they really function the same. right? Most of the people on Wentworth Douglas's board are not healthcare people. They're bankers and business people and other people who understand how to run large organizations, but aren't, for the most part, healthcare people. And so the CEO brings a team of executives who come up with strategic goals and says, this is the direction we think we should go. And the board, weighs in on that using their own judgment. They also monitor the financial performance of the organization. So every month when the board meets, the CFO presents the numbers for the organization. How are we doing relative to our plan for the year? So that's what the board does. That's the appropriate level that the board operates at. I have talked to people, CEOs of small organizations, where the board starts getting into well, how much? Why are we paying Susie this much as opposed to Bobby that much? That's a problem board, right? The board should be at the strategic level, and if they don't trust the CEO's judgment about the day-to-day operations of the organization, then they need to fire the CEO and get a different CEO, right? But the board should not be involved in the day-to-day operations of the organization. The board's purpose is to provide the general direction of the organization. So the board is appointed by the shareholders. So there's a vote, right? So if you are a stockholder, you will get a proxy vote. Typically, each year you'll get a letter saying, hey, here's the slate of candidates. Do you want to approve this slate of candidates or not? So, so I see that periodically for the firms that I have stock in. And then, I'm usually not paying all that much attention, so I typically say, sure, whatever, and let it run. Because my main recourse as a small investor is, if I don't like the direction that the organization is going, I just sell my shares, right? And I buy something else. We're talking kind of about a large firm, but a small firm, like a family-owned firm, could be set up as a corporation, in which case, chances are management is also going to be the ownership, right? So if one of you set up a company, right, and you said, you know what, I'm going to set this up as a corporation, you could also be the 100% owner of the corporation, and you could be the board, right? And then it kind of ranges between size, depending on the organization, how big, how many owners, and how formal the process is. Okay. So for-profits have shareholders or stockholders. For-profit corporations have shareholders or stockholders. It means the same thing. They own shares in the firm, right? The number of shares they own represents, or the percentage, the number of shares out of the total number tells you how much control they have over the organization. It is basically, the standard situation is one share, one vote, right? So if you own 40% of the shares, you get 40% of the vote, right? If you own more than half of the shares, this is typically a majority rule kind of organization. If you own more than half of the shares, you get to elect you get to decide on the direction of the firm. The direction of the firm is typically done through a board of directors who are elected by the shareholders, because typically shareholders don't want to be involved in the day-to-day management of the firm. Like, I own shares in Genesis. I have no interest in in being part of the day-to-day management of the overall corporation, right? I trust the board of directors to oversee the CEO. Now, a not-for-profit, but remember, at the end of the day, right, the shareholders are the owners of the business, and whatever profits the organization makes over and above, so whatever's left over at the end of the year, for example, whatever profits, so they've got revenues and then they have expenses, and whatever's left after that is what we call profit. That profit belongs to the shareholders. Whatever money that organization makes above its expenses, right? So whatever's left, right? Whatever's left belongs to the shareholders. This is the key difference between a for-profit corporation and a not-for-profit corporation. Well, one of the key differences. So now let's talk about a not-for-profit. corporation. So, for example, Wentworth Douglas. Wentworth Douglas, well, now Wentworth Douglas is part of a larger part of the Partners or Mass General Brigham system. So you can think of Wentworth Douglas, but it has historically been an independent entity. Exeter Health Resources, the parent company for Exeter Hospital, is still a standalone entity. The key difference between a not-for-profit entity and a for-profit entity is what we refer to as the non-distribution constraint. Non-distribution constraint. What does that mean? What that means is what I just said a second ago. A for-profit corporation owned by shareholders, at the end of the year, whatever profits are left in the bank account after you've paid all your bills, those profits are the property of the shareholders. And that money can be, one of the things that the corporation can do is they can distribute that money as what's called a dividend. And we'll talk more about that in the next couple of chapters, 3 and 4. We'll get into what that is, but basically it's just they can cut a check. Like let's say you know, we had let's say I'm running a durable medical equipment company, right? So I think that was the example that Cole and his uncle were going to run a durable medical equipment company. That's what we talked about last time, right? So and let's say they set that up as a corporation, and Cole owns 10% of it, and his rich uncle owns 90%. So they would have, let's say there's 1,000 shares, Cole owns 100 shares, uncle owns 900 shares, right? The uncle has 900 votes, Cole has 100 votes. Now, maybe the uncle hires Cole to be the CEO of the organization. Different things, right? So, so Cole runs the organization on a day-to-day basis, but the uncle owns 90% of the company. At the end of the year, let's say they've had a very good year, and there's $1 million left over. They could decide to distribute, right, pay out in the form of a dividend that $1 million in profit. Now, they probably wouldn't. They'd probably retain, we talked about this, I think, last time too. They would probably retain a portion of that to replace things that are broken and to grow the business. But they could, let's say they decide to keep half and pay out half as a dividend, in which case Cole would get, let's say it's 500,000, half of $1 million is 500,000, right? In which case, if the board approves the dividend, so this is one of the things that the board only can do, the board approves the dividend, and the board is uncle and Cole, right? And the uncle has 90% control. So basically the uncle decides what the dividend will be. And the uncle says, I think we'll pay ourselves 500,000. We'll pay the shareholders $500,000. Cole gets 10% because he owns 10% of the company. He gets 50,000, and the uncle gets 450,000. Right? Does that make sense? Okay, so that's how that can work. They can distribute the profits. In a not-for-profit, that's not allowed. So that's what the non-distribution constraint means, is under a not-for-profit charter, you cannot ever pay out the profits. The profits all have to be reinvested or retained by the entity, by the not-for-profit entity, and used to move the organization's mission forward. So if you're a not-for-profit hospital, I'm going to hit Emma and I'll come over there. If you are a not-for-profit hospital and at the end of the year you have profit of, say, $1 million, so if Wentworth Douglas or Exeter shows $1 million profit at the end of the year, they have to reinvest that $1 million in providing care to their community. They are not allowed to distribute in the form of a dividend to their investors, and in part that's because as a not-for-profit you don't have any investors. All right, so Emma, and then, sorry, I don't remember. Jessica.
when the decision comes to, you have to either promise it or you're going to distribute or retain. It's the board of directors makes that decision for the shareholder.
Right.
So if your product comes in and the shareholders are all want the money, the board of directors says we're going to keep some of the reinvested in the mission that's reinvested in the way.
Right.
Then no, you can't have them.
Right. Okay. So I'm going to repeat your question for people on Zoom. So so the question was, if I'm going to try to repeat it. So the question is, who decides the distribution of the dividends? That is the board. They make the decision. So even if there are some shareholders who are like, we really like to have a big dividend, the board of directors is the deciding body for that purpose. Now, if enough shareholders say, hey, we told you we wanted a bigger dividend and you didn't give us a bigger dividend, they get voted out. Just like, it's kind of a democracy in that sense, right? It's a democracy that's determined by how many shares you have, right? So unlike one man, one vote, right? This is one share, one vote. Okay, Jessica. Right. They don't have shareholders, and so not-for-profits. So this is the key of the non-distribution constraint: no dividends. I mean, that's kind of the simplest answer: no dividends. Right? They are not allowed to pay out any dividends. Now, they aren't allowed to pay out any dividends because there are no shareholders. So, nonprofit, no shareholders. So, and so that's part of it, right? And then the non-distribution constraint requires that that any residual, right, any residual profit must be reinvested or retained. Okay. So if a not-for-profit hospital like Exeter has a profit at the end of the year, it must reinvest it in providing health services to the community. It cannot pay out some amount of money to some other shareholder because there is no shareholder. Yes. Yes, and they do, right? So the question is, can the board of a for-profit hospital retain the money and then not reinvest it, like not buy more equipment, not replace old equipment? The answer is yes, they could have cash, right? And most organizations have some amount of cash. I'm not sure how much they're sitting on now, but Apple, probably most of you have an iPhone or an iPad. I'm looking, to see them around the room here, right? Apple, hugely profitable company, was sitting on a stockpile of like $50 billion in cash for a long time. Now, Apple is a public company with investors, with shareholders. They could have paid that $50 billion out in a great big dividend, or they could take the money and make some sort of other investment. And so there was a bit of a stink in the, in the financial community about and it wasn't just Apple, it was Microsoft, all the big tech companies were sitting on these huge amounts of cash, just extraordinary amounts of cash. $50 billion is more than the GDP of some small island countries, right? So, Costa Rica probably has a GDP of about 50 billion. I mean, maybe not, but it's a crazy amount of money. And so a lot of, there was a big buzz, in the financial community. What's going on? Why are these companies doing it? So the answer is yes, they can retain and hold cash. Okay, so similar question, can a not-for-profit retain it just as cash as well, is basically what you're asking? And the answer is yes. Not only do they retain it like a for-profit company, but they tend to retain more. Not-for-profit companies tend to sit on very large cash reserves. And we'll get into why that is later on, but basically it's because they don't, a for-profit company can always sell more stock to try to get additional resources. A not-for-profit company can't. And so a not-for-profit company, because there's no shareholders to sell the stock to, right? So there's no stock. So, so they are in a situation where they have to retain. So as they earn, and we'll get into some of that later, but as they earn profits, they set that aside to, you know, build new buildings and things like that. So when you look at the books of a for-profit company, sorry, of a not-for-profit hospital, for example, they tend to have a large, even relatively small companies tend to have a large, small not-for-profit hospitals tend to have large cash, large amounts of cash set aside in long-term investments. So it's not sitting in a bank account, but it's sitting in long-term investments, you know, to the tune of hundreds of, you know, $100 million or more, say, for example, for Exeter. I forget exactly how much they have, but it's a lot, right? It's a lot of money. Okay. A shareholder, right, is called a residual, or an owner, I should say, a residual claimant. Right, shareholders are a kind of owner. So all owners are residual claimants. So whether you're a proprietorship, a partnership, or a shareholder in a corporation, you are a residual claimant. Residual means the stuff that's left over, right? So when we talk about a residual claimant, in this case, what we're talking about is owners have a right to the profits of a company. So if you're a sole proprietorship, you know, you have a dog walking business and you have $100 in revenues and $50 in expenses, the $50 in profit that you have is yours, right? It's what you earn from your business. You are the residual claimant. The profit is the residue after you pay all your expenses. Did I see a hand? Right. So this primarily applies to for-profit. It really only applies to for-profit. This idea of residual claimancy. But you could think of a not-for-profit in kind of an abstract way as so here's the way to think about ownership of a not-for-profit. Wentworth Douglas, before it became part of the Mass Gen system, if you think of Wentworth Douglas or you think of Exeter, for example, which is still in its own kind of independent status. Let's talk about Exeter in particular. Exeter's mission, Exeter Hospital's mission as a charitable not-for-profit entity is to provide for the health and welfare of the Rockingham community, right? Rockingham County is where they're at, right? If you look at their mission statement, it's going to say something to the effect of they exist to provide high-quality health services to the people of their community. And if you think about a hospital, is anchored to a physical location, right? It's not going to hop up and move to another town, right? So it exists. A hospital exists to provide services to a locale, right? And that's true, really, whether you're a for-profit or a not-for-profit, except that with a not-for-profit, the owners of the not-for-profit are kind of notional. They are the community, right? The owners of Exeter Hospital are this kind of abstract, amorphous blob we call the community, right? Nobody in Exeter and the surrounding towns owns shares of Exeter Hospital. Because they don't exist. The hospital is owned in this kind of abstract way by the community, and it is responsible to the community. And so all not-for-profit entities have to also have a board, and it kind of how the board is derived kind of depends on the mission of the organization. For a hospital, typically you're going to have some method of drawing board members from the community, right? You're not going to want, Exeter Hospital is not going to want somebody from Portland, Maine, right? an hour and a half up the road, sitting on the Exeter Hospital board. They might get hired as a consultant, but they're, but what you're going to want is people who are going to represent the owners, right, on your board, right? So the board is still, even for a not-for-profit, is supposed to represent the owners. Now, ownership of a not-for-profit is a little more of an abstract kind of conceptual thing. Nobody really owns it per se. It's owned by the community. So you're going to want representatives from the community to be board members. And so Exeter Hospital, being a relatively located in a relatively wealthy town, not really a problem to find, successful business people to sit on their board. But typically what you will do is there's a number of kind of steps, and I'm not going to get, and it kind of varies, right? There's a lot of variability about how board members are selected. Typically, there might be kind of layers. There'll be like what they call incorporators. So basically, you have to, excuse me, you have to show an interest. You become a corporator. It's pretty easy to become a corporator, and then you are elected. The board members are then elected by the corporators. I did an interview with Peter Wright, who used to be the CEO at Valley Regional, and he talked through this whole process. But basically, to become a corporator for, say, Valley Regional, which is up in Claremont, you basically just have to show up. You have to be a member of the community, and you have to show up at the periodic incorporator meeting, and then you get a chance to vote for who goes on the board of the hospital. It's kind of like that. It's that simple. But in order to be on the board, you have to be a corporator, right? So you have to be from the community. So hopefully the judgment of the of the community is represented by these people who have the time and the interest to become corporators, and then volunteer to be on the board. Not-for-profit boards, board members, the trustees. So the word is slightly different, but they really do the same thing on a day-to-day basis. Board of trustees are entrusted, right, with the management of the not-for-profit, so that the not-for-profit is taking care of the community. The board of trustees is, once you establish your board of trustees, the function is identical to a for-profit board. It is to provide strategic oversight of the organization and to hire and fire the CEO, basically, right? And through the CEO, manage the organization. So one big difference is that I find kind of humorous is to be if you are a member of a board of directors of a for-profit entity, you are typically paid. It is a paid position, right? You are essentially you are doing something for profit, right? So you're there representing people who are investors investing in a company expecting to get a return. And so the investors pay the board members, and it's depending on the size of the company that you're talking about, it's a not insignificant amount of money, right? To the tune of hundreds of thousands of dollars to be a board member on some of these. It's a part-time job. Don't get me wrong, but if you're a board member for HCA, you're probably getting a couple $100,000 a year to be a board member, right? The humorous part about not-for-profits is if you're a trustee on the board of trustees, you get to pay for the privilege of being a trustee, right? It's considered a privilege, right, to be a trustee. So if you guys have Jameson for management, she's on Wentworth Douglas's board, if she hasn't already mentioned that to you. She gets to pay Wentworth Douglas. Not paying. She makes it. She is expected to make a donation, a significant donation, to Wentworth Douglas for the privilege of basically a part-time job working as a board member. She does a lot of. She'll talk about it. She does a lot of hours each month for Wentworth Douglas. So, but that said, really the difference there is for a not-for-profit. There's some process whereby the trustee is selected, and it kind of depends on the mission of the organization. So typically for a hospital, a not-for-profit hospital, because you're servicing a very clear geographic community, your board members, your trustees are going to be drawn from that community, and they're going to be elected in some process by members of the community, right? If you're, and so, but that's not the only kind of, hospitals aren't the only kind of nonprofit out there. You also have, you also have advocacy organizations like the American Cancer Society, right? So the American Cancer Society doesn't have a geography that it's caring for, except that it's national, right? So there'd be a different way of looking for board of trustees for them. It's a little bit different, but the essence is the same. The American Cancer Society also has a board of trustees, and that the function of the board of trustees is to set the strategic direction of the organization and choose the CEO and oversee the CEO. Yeah, so the question is, do they try to get like a different walks of life, different representations? So for your board, right? So do you try to get a representative population on your board? So remember, your board has to be pretty sophisticated. So this is there's a balance there, right? Why are mostly rich old people on boards? Because they are successful business people, and they understand how to run organizations. They understand how to manage organizations. So your board members need to be both representative of the community and drawn from the community, but they also have to have the skills and abilities to manage a large, complex organization. So you wind up with this kind of tension, right? If you talk to, so I mentioned before we started recording, that there's a mental health center in Manchester that's interested in having interns. They, as a not-for-profit entity, they will have a board. That board is drawn from most likely the Manchester area, right? Should be drawn from the Manchester area. Most of those kind of community mental health centers, as well as federally qualified health centers, which is more of a, as opposed to a mental health center, it's a nonprofit non-mental health medical care. So like Lamprey Healthcare, you may have heard of it's based out of Newmarket, and has offices in Raymond and Nashua. When I talked with Greg White, who's the CEO, he explained that half of their board have to be patients of their organization, which I think is kind of cool, right? So you have to be half of the board. So not only are they drawing from the community, so they can't just draw, and this is a federally qualified health center, so their main population are Medicaid eligible patients, Medicaid and uninsured, right? Not uninsured because they're rich, but uninsured because they can't afford insurance. So half of their board has to be drawn from the population that uses them for services. So that's not going to be some rich old banker, right? So there's going to be a mix of, if you talk, I talked with the CEO, Jay Kuchar, who's the CEO of Seacoast Mental Health Center, which is all similar structure, right? They're primarily, they take care of poor people with, their primary population is poor people with mental health issues. She also has a mandate to have some percentage of the board be patients, right? So now you have, so the answer is yes. I think particularly not-for-profits, they try to get representatives from the community, accurately representing the community on their board. And then it'll also be, obviously not just patients, but if you're a hospital like Exeter, you want to find racial, gender, sexual preference, because you want to have that, you want to have all those voices guiding the organization, so that you're not, particularly because if you're say Exeter, you need to be looking out for the well-being of the entire community, right? So you don't want just a bunch of white old men, right? Because even if they're kind-hearted and so forth, they're not going to think of necessarily all of the needs of the community. Can we hit all the important points? Now, a not-for-profit, as a corporation, is a legal entity we talked about before. So just like HCA, I talked last time, is from the eyes of the law, is a legal entity, right? A legal person, if you will. It can own property. It can enter into legal contracts that are legally binding, right? and it does so with, you know, the management of the organization acts as its agent, right? But from a legal perspective, the owner, the not-for-profit entity corporation is the same as a for-profit corporation in that sense of it being a legal entity, right? Ownership is the key difference between a not-for-profit and a for-profit, and it comes down to that. And the key difference is that non-distribution constraint, right? And that has kind of knock-on effects. It has other effects, right? Not being able to distribute the profits, but having to reinvest all the profits. The reasoning behind that is, if you know you can't, as an investor, you can't pull money out of the organization, and that it all has to stay there, that motivates hopefully the goal is it motivates a different kind of behavior by management, right? The board is not going to be putting pressure on management to say, let's squeeze some more cash out of this so we can pay it back to our investors, because there are no investors. And so the idea behind a not-for-profit is they aren't motivated to just by in terms of profit that they pay back to their investors. They're motivated, you know, ideally they're motivated by the good of the community. Okay. Let's see. Not-for-profits, another key difference here is nonprofit charitable entities, nonprofit charitable, such as hospitals, so 501c3, right, which refers to the paragraph in the tax code, are tax exempt, meaning no corporate income tax. And this becomes important later on. It's something you should know, but it also becomes important later on in some of the work we're going to do in chapters 3 and 4, because it changes the way some of the we'll look at the effect of taxes on profit going into the future. Okay, so tax exempt. What does that mean? Let's say Portsmouth. Portsmouth is a for-profit company. But it's part of the larger HCA. But let's imagine Portsmouth was a standalone for-profit hospital. And then we have Exeter Hospital down the street in Exeter, right? If Exeter makes $1 million at the end of the year, it gets to keep the whole $1 million. If Portsmouth makes $1 million at the end of the year, it has to pay, if it shows a profit of $1 million, it then has to pay taxes on that profit. Pays in. Right now, the corporate tax in the United States is 21%. So if it made $1 million, it would have to pay $210,000 in corporate taxes. So it would have $790,000 left over after it paid its taxes. Okay? We had a question. I think Jessica asked the question earlier. No, you're Jessica. I'm sorry. Caitlin asked the question, I think, earlier about can a not-for-profit just keep its money? Was that you? So. Not-for-profits are expected to keep that extra $210,000 in order to either provide services today for the entity, you know, to provide additional services today for the community, or save that money to build a new building or whatever in the future. Right? So the idea there is that money that is not collected in the form of taxes is going to be used by the not-for-profit entity to continue to provide goods and services for the community, which is why they're not being taxed, right? As opposed to a for-profit entity. Right? The idea being that the taxes taken from the for-profit entity will be used to provide goods and services to the community. Durham is has a challenge because it has a very small tax base. So if you live in Durham, the town's tax base does not include the university, right? The university is I think it's coming your way. The town of Durham does not collect taxes from UNH, right? UNH is this enormous entity in the town, but it doesn't collect taxes, but it does use, you know, to a degree, it uses services, you know, got police and fire and stuff. So Durham, if you own property in Durham, because New Hampshire, everything is financed by property taxes. If you own property in Durham like I do, you pay a really high tax rate. All you have to do is move to Dover and your tax rate drops by about 40%, right? So if you buy a house in Durham, you pay a significantly higher, like 50% more taxes, a 50% higher tax rate than you do in Dover. Does a census, okay. Yeah. 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 I mean, there's so Emma's making the point that, the government to some degree does take into consideration the flow of students in and out of the community. Yeah. Right. 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 I mean, the town literally doubles in size when UNH is in session. And so, yeah, so we probably do get some funds from the state and maybe some federal funds as a result of the number of people in the town. But the primary source of funding is local, right? And it's local taxes, because that's the way that's one of the challenges of New Hampshire is everything is very local everything is very locally funded because of the property tax base. And so, it's one of the less pleasant things about living in Durham. Great town to live in, that's not one of them. Okay, let's see. A little behind, I'd hope to get into chapter 2 today. So I'm gonna at least try to wrap up. So you could think of, for a not-for-profit, you can think of stakeholders versus shareholders. So you can think of, people in the town or in the community are stakeholders in the sense they have an interest in the organization and the services it provides, but they are not shareholders. So it's a difference in ownership. The non-distribution constraint prevents management or the board from paying out any of the profits, and they must be reinvested back into the organization. For-profit corporations pay taxes, so they have to file a corporate tax return. Not-for-profits file an IRS 990. IRS 990, which I showed you the other day. And if you're ever interested, if you're doing research on a not-for-profit, one of the first things you ought to do is pull up the IRS 990. So if you have at some point, if you're doing work for policy or whatever, and like Professor Ator asks you to do research on some entity, if it's a not-for-profit, you will have access to its 990. It's a public document. You can just go on the web and Google it. And there's different organizations that publish them. Not that hard to find. There's sometimes a bit of a lag, and you might not be able to get last year's, but you can get the year before's. And you can. What's interesting about that is, for example, for a hospital, it's going to tell you. It'll tell you. Well, for all not-for-profits, it'll tell you what their mission is, their ostensible mission, their community they're supposed to be providing care for. And then for a hospital, it'll get into. It'll provide you a lot of detail about the community needs that they're supposedly meeting, which is some interesting information. We see a lot of consolidation happening in the not-for-profit world. So hospitals across, and not just not-for-profit, but all hospitals, the hospital industry is becoming, it was historically quite fragmented, meaning, Exeter was its own organization, Wentworth was its own organization, Portsmouth was once upon a time its own organization, not that long ago, was its own organization. Lots of hospitals that were very independent. In the time I've been here 5 years, in the time I've been here, I've seen, we have 26 hospitals in the state of New Hampshire. It's a small state, 26 hospitals. I want to say, when I first got here, most of them were independent. And in the last 5 years, most of them are now part of some larger system. I'm trying to think if there's one that's, Concord is still independent, LRG is still independent, though there's a lot of rumors flying around that maybe they will, merge into some sort of organization, or Concord will absorb LRG. I mean, that's pure speculation. I think those are independent. There might be one other one, but I mean, it's like St. Joseph's is part of another system. So, it used to be, it wasn't that long ago that most of the hospitals were independent. Now most of the hospitals have merged, right? So Elliott and Southern New Hampshire have become, one entity. Catholic had absorbed Monadnock and Huggins in Wolfboro. Now Catholic and that system, Granite One, is in the process of merging with, or affiliating, they call it affiliating, but affiliating and creating one system with Dartmouth Hitchcock. Dartmouth Hitchcock already had Cheshire and a couple of other hospitals. So, there's 4 little hospitals up in the North Country, 4 little critical access hospitals in the North Country, Androscoggin, Cottage, and 2 others, initially set up a 4-hospital system, and then one of them dropped out. So I guess that's one more that's independent. But what we're seeing is this consolidation of organizations across the country, where hospitals are merging into larger systems. So then you wind up with ultimately one board of directors, right, or board of trustees. You may have a local board that oversees quality, and I think you'll talk about that with probably in management more, where there's kind of a system board that makes decisions about finances, and then a local board that does things like approves new physicians. And there's a lot of things that boards do that we're not going to get into in this class, but we'll probably talk about in management. All right, so I'm a little bit behind already after just a week. So we'll do a little bit of catch up and get into chapter 2, which is a lot. We start getting into the details of insurance. Questions? We got 5 minutes for questions. Does Canvas say 11:59? Okay, then it's due at 11:59. Yeah, I'm not going to collect it. I don't want it, so you need to submit it, right? So homework needs to be submitted electronically, so you can either, send it to me as pictures, take pictures of your written work with your phone, or, preferably as we start to get into numbers, I'd like you to start practicing using Excel. You're going to need to learn that skill. It's important that you learn that skill. So, but this time around, it's it's just text, so probably Word document will be fine. All right. Anything else? All right, so I will save this. Any questions from Zoom land? Okay. We'll see you on Thursday then.